Hi, welcome back. So you saw from those last two videos that the use of a diagnostic and statistical manual is not without controversies. Most practicing psychiatrists and psychologists do use the DSM, and they believe that it is important for us to all speak the same language when we diagnose mental illnesses. But perhaps because of the convoluted history of the DSM, and because of the big difference between psychiatric disorders and medical disorders, there are a lot of people who have some troubles with the way the DSM has been written, the way it is used, and the whole point of view which treats mental illness as if it were a medical disease. We may yet find out exactly how the brain disorder causes the mental and behavioral disorders we seek to treat, but at this moment, we're really at the very early stages of neuroscience and psychiatry coming together as medicine. And so regardless of what you may hear from proponents of a medical view of psychiatry, we really don't have any simple relationship between mental disorders and medical diseases or illness. There are no tests, there are few biochemical markers we can use, and so we're still left in a position of having to trust psychiatrists to tell us what is normal and what is abnormal. And so if that's the case, why should we use a medical model at all? Why does the DSM exist? Well, for one thing, we do believe that behavior is a product of brain function. And so we do believe that unusual behavior, abnormal behavior, disordered behavior is a product of unusual, disordered brain function. Secondly, the use of a standard reference material like the DSM legitimates psychology and hopefully removes the stigma from the sufferers of mental illness. If there is a mental disorder and someone is suffering from it, then their unusual behavior or, say, depressed mood is not a character flaw, but a true illness. We should be wary, though, that this same label may actually reinforce a stigma. When a patient is diagnosed as having, say, depressive disorder, that often serves as a badge or a marker that is hard to get rid of. And even though many mental disorders might clear up on their own or through treatment, once you've been labeled as diseased, that often leaves quite a stigma for the patient to overcome. And finally, using a medical model greatly helps objectivity in diagnoses. If every psychiatrist is using the same book, then we all are talking about the same thing. We can use the same symptoms to diagnose these disorders and perhaps prescribe specific treatments for each of these disorders. This becomes particularly important with the rise of pharmacological treatments, as we'll see in upcoming lessons on treatment and psychopharmacology. So while there is great consensus within psychiatry and psychology for a medical model of mental disorders, it's important to note that not everyone agrees. Some people, and this is discussed in your textbook as the myth of mental illness viewpoint, see that human behavior is really a continuum of lots of different ways of being and thinking, and that diagnosing some as ill is really more of a political and social judgment rather than a statement of medical fact. That political and social judgment can be used to guide medical policy, public policy, and the behavior of insurance companies and the people who use them. In this class, I prefer to take a middle ground view. Clearly, the DSM is a political document that describes the judgment of a group of professional psychiatrists. However, it is used to treat people who are suffering, who have harmful dysfunction and need some kind of treatment. If we take a pragmatic approach to mental health, we can use the objectivity and standardization brought by the DSM to try to find treatments that can transform neurosis into the ordinary unhappiness that all of us suffer through the trials and tribulations of life. That is the best we can hope for in psychotherapy. An accurate diagnosis can only help this goal.